Hello, it's Dr. YouTube. I regularly upload medical educational videos. In today's episode, I will talk about COVID-19 vaccine. Based on my experience dealing with COVID and non-COVID patients during this pandemic. Now, as of 20th of March 2021, there have been at least about half of the UK population have now been vaccinated with the first dose, and that's really good news. So hopefully this video will try and propel that vaccine effort. And here I will focus on the two main vaccines offered in UK. There are actually three, but here I'll focus on Pfizer and AstraZeneca. Now, the Pfizer vaccine is an mRNA vaccine. The human body contains DNA vaccine. The Pfizer contains an mRNA vaccine, so it's two different types. Main thing is you do not get COVID by having the Pfizer vaccine, or any other vaccine, to be honest. With the Pfizer vaccine, it contains mRNA. This mRNA basically codes for protein, the spike protein, as shown here. So codes for this protein, your body produces this protein on the cells, and therefore prompts the body to create an immune response to act as if this was the viral infection. The purpose of that is so that when you have an actual coronavirus infection, your body is able to mount a much bigger response to that effect. It's like having a past paper. Not having done a past paper, you probably have less of a clue of how to write down answers. But having the mRNA, in other words, the past paper, hopefully your memory, with your memory, you can write down the answers much quicker and mount a much bigger response. I hope that answers the question. As I said, it doesn't alter your DNA. Like the AstraZeneca vaccine, it's given 2 doses apart. And ideally, it should be given 3 weeks apart. But in the UK, they're spacing out to 3 months, mainly to get as many people vaccinated as much as possible, which kind of makes sense. It's most effective 7 days after the second dose and is quoted as 95% effective, which is higher than AstraZeneca. Now, it should be postponed, however, if you have any illness, including having had COVID-19, you should wait for about a month. Side effects are actually more common with the Pfizer vaccine, with pain, fatigue, and headaches, more than 50%. You shouldn't be having the vaccine, or you should have a discussion with your healthcare professional if you have anaphylaxis in the past, or for example, you've had a very bad reaction with the first dose. Of note, it does not contain pork or animal products. Now, with the how effective is the vaccine? Well, looking at the data in the New England Journal of Medicine, which is a paper highly quoted, it looked at comparing those who've received the Pfizer vaccine, BioNTech, and those who didn't, the placebo. Comparing those, about 18,000 on both sides. They looked at the COVID occurrence after the second dose. So amongst those about 18K who received the vaccine, only 8 people developed COVID infection. However, of those 18K who did not receive the vaccine, 162 of them developed COVID. So therefore, the efficacy is quoted as 95%. So remember, it is most effective at least 7 days after the second dose. Now, how about the AstraZeneca vaccine? It is a genetically modified virus. The adenovirus, the virus that causes common cold. So how it works is basically the labs, they modify the virus to mount the body to create an immune response to this common cold virus. Again, does not contain the coronavirus, does not alter the person's DNA as well. Like the Pfizer vaccine, it's given 2 weeks apart, 2 doses apart, slightly less effective than the Pfizer vaccine, 62 to 90%. It should be postponed if you have an acute illness. Now, in the UK, it actually advises 4 weeks for both the Pfizer and AstraZeneca if you have an acute illness or COVID. But in the USA and the CDC, they actually recommend 3 months, so slight difference there. As I said before, Pfizer vaccine, more side effects, with the AstraZeneca slightly less, 50-ish percent. Interestingly, you're less common to have these side effects if you're above age 65. So in my healthcare professional colleagues, a lot of them under age 65, it seems that more of them have those side effects. Obviously, nothing disabling as such. Does not contain pork. Some interesting literature I looked at. So this was, again, a paper looking at COVID vaccine with the AstraZeneca in those who had the vaccine and in those who did not. The numbers were slightly less, 5,000. Remember, with the Pfizer, they had about 16 or 18K patients. But anyways, so about 5,000 odd patients who received the vaccine, 30 patients developed COVID compared to those who did not receive the vaccine, 100 of them. It also reduced the chances of having a severe disease and hospitalization, so none of those required intervention compared to those who required. So quoted efficacy about 70%. As I said before, it's most effective when dosed at least 4 to 12 weeks apart. Interestingly, it is more effective if waited at least 12 weeks apart than those shorter. For example, you can see more cases reported and higher efficacy in those who waited 12 weeks apart and those who waited less than 6 weeks apart. So what are the key points here? First of all, having the vaccine does not cause COVID-19. It's like having a pastpaper. Your body is able to mount a much bigger immune response when the actual virus enters your body. Reduces your risk and severity of the infection. Now, I know a lot of BAME, black ethnic minorities, are not having, a portion of them, I guess, are not having the vaccine because of misinformation. They've been told that it contains animal and egg products, but the fact is it does not contain that. Nevertheless, even if you've had the vaccine, you still need to protect yourself and others by sticking to strict social distancing, hand hygiene, masks, and so forth. Because although it prevents yourself from having a severe COVID infection, it doesn't prevent transmission, at least not yet. The evidence hasn't shown that yet. You have to be aware of the side effects. The side effects, as we said before, headaches, muscle aches, and pain, which may be more prominent in those receiving the Pfizer vaccine in the AstraZeneca vaccine, and also probably more in those who are a bit younger, probably because they're able to mount a bigger immune response, and that will show up in the side effects. I hope you've liked this video. If you do, please give it a thumbs up, like, and subscribe. Take care, and look after each other. Let's carry on with the vaccine.